And I'm very glad to be here. And what I will be discussing is psychosocial stress related to bladder cancer in particular. Most of my work at Mayo Clinic has been with psychosocial oncology, so I'm embedded within the Mayo Cancer Center here, the Comprehensive Cancer Center. So I do work with a lot of individuals who have been recently diagnosed with bladder cancer. I see all types of cancers, but bladder cancer is it's a big proportion of my patients. And so I will be talking. I just want to give this a very brief presentation because I want to give more time for all of you to ask me questions so that if I can help in any way to clarify things or just to get some answers, I'll be more than happy to do that. So just bear with me. I'll just go through. This is a pretty brief slide deck that I have. Just to start off, I do not have any relevant disclosures, no financial disclosures, pertinent disclosures in relation to pharma or anything like that. And I will not be discussing any specific brand name drugs or anything. So I just wanted to bring all of your attention to what happens when you have it's a pretty significant diagnosis, and like Stephanie, you mentioned, it can be life changing. It can be like what is the meaning that we are ascribing to it, and a lot of times how we look at it, how we process it emotionally is very dependent on the biopsychosocial factor. So it's basically they talk about, so there is a biological component of how you respond to stress, and there is a psychological factor how you respond to stress, and then there is a social factor which is really important. And as you can from my understanding, we have patients and caregivers here, so it's the social component is really important to have social support. What are your beliefs and emotions related to the diagnosis? Prior to the diagnosis, how did you handle more medical things, and how difficult has this been for you? It also relates to your style of coping, which is we've had years and years of developing that, and it really depends on how we were raised, what are our belief systems. So that all goes into the emotional distress. And in my practice, I see a lot of anxiety and depression related to the diagnosis. And especially, I know, Stephanie, you had mentioned in the email that the discussion we had that there are some points that happen. I think one of them does happen to be the diagnosis, and if there is a recurrence, which does happen sometimes with bladder cancer. So there can be a lot of times we don't talk about how life changing this is, like the grief of high. A lot of times my patients describe it as a before and after. So there is a lot of like sense of loss, how lifestyle has changed. If you're having more, a lot of my patients talk about having multiple appointments in a week, in a month. It kind of like your life starts revolving around that. So there's a lot of grief associated with that feeling of loss. And again, as I was talking, like your coping skills. So I think beliefs and emotions are a big part of it. How do we look upon this diagnosis? What do we bring with it? Like, what does it bring in, you know, internally, how you're feeling about that? Is there a lot of guilt associated with that? Do you have this feeling that, oh, I should have caught this symptom before all of this like really advanced? So a lot of people can have those kinds of feelings trying to understand it. So there is a lot of distress associated with what's the course going to look like. Sometimes lot of times when you start out, they might not know. They have to stage it and do things. There are like numerous tests. So it leads to all like, how do we handle that? And then again, it's the distress, and sometimes it presents in different ways. It can be feeling like low and feeling really, really irritable. People are like, oh, whoa, what happened? I just asked you a question and you like, nope, not right now. So it can present in different ways. There can be anger, there can be a feeling of like, why me? Which is, I think if you put it all together, the psychological factors, I think it's all a very normal human reaction. So there is no pathology here. There is a way we are coping with it. So I really do want all of you to think about the psychological factors associated with a diagnosis and treatment of bladder cancer as being a very normal part of the journey. There is nothing that is abnormal. You're not suddenly have major depression. You might, you may fall in the criteria of DSM, like the book that we follow to diagnose, but I think it's all very normal human reaction. It can be anxiety. It can be anxiety about what's going to happen with the the surveillance, like the scans. I have a lot of people who actually either see me just before their scans or right before, after their scans, like to just kind of like process it, because it's very scary what they're going to tell you. If you're really looking for how the treatment is progressing, if the chemo is working, if the radiation is working, there can be depression. You know, you can feel low, you don't want to do anything, you've stopped doing things. Like, let's say someone really likes to, I have a lot of patients here who play golf a lot. So we have, when you're not going out, you're not eating out, and you're not going out to play golf, you're not really connecting with friends, you're trying to like it can be a lot, right? People texting to ask you, how are you doing now? You know, people, it's a good intention, but it's become so heavy sometimes to respond to that. So it can present as depression, but again, it's a part of that emotional distress. There can be a lot of grief, like I talked, like before and after all the changes you go through, all the side effects of medications, chemotherapy, radiation, if you've gone through surgery, you know, like there can be just so much, like different components that you're, it's like a moving puzzle that you have to put the pieces together. So there's a sense of loss of that lifestyle. There is a lot of stress associated with it. Like what is the diagnosis going to be like now? What is the staging? Is there a recurrence? Like every small symptom, I've had patients, everything, you know, they sometimes people avoid thinking about that, so go the other way. And sometimes people just become like, they really need to know from their physicians what's happening. So there can be different like ways that people present. And then when do we seek treatment? It's especially psychologically when you do that. It's just a high, very high level of distress that is impairing your functioning. There is increasing withdrawal, anger, isolation. You stop responding to your spouse or your kids, and you just want to be alone. A lot of hopelessness that things are not going to get better, how bad this is going to be, and just really like feeling stuck and kind of like also withdrawing from treatment, or just like really feeling that you have to see your physician or ask them about a lot of symptoms that are coming up. So just either engaging with them more or just kind of withdrawing. So a lot of the treatments that are available that we do a lot is psychosocial support. So I hope that as part of your oncology teams, you have social workers to support you. They can do a lot of supportive psychotherapy, provide resources. They're a really good resource to have on your side. So I know Mayo Clinic does that a lot. They get assigned to a social worker as part of the Comprehensive Cancer Center. And there can be psychotherapy that a lot of my colleagues in psychology do. And then we can, if it's like we feel that it's really impairing your functioning, you're not able to work, you're not able to do the things that you used to enjoy, then medications is a good option. I always tell patients that, again, it's like adjustment to the illness. So that's like that's a journey, that's a, you know, it's a phase. And I generally tell people that most people, it really depends how long they need to be on medication. It's hard for us to predict, but mostly I'm very hopeful that we can take you off after like a year or so, or a few months, depending on how you're responding to everything. And then at Mayo, I've seen a very good um, uh, you know, support from palliative medicine for cancer symptom control, and that we work very closely. For most cancer centers have psychiatrists and palliative medicine working very closely to manage the symptoms. So they do a lot of like pain control and things like that. They are very, very helpful. So I encourage all of you to, if you have that as part of where you're getting treatment of that organization, to reach out and ask if that would be an appropriate referral for those who are not connected with palliative. So that was like just my like a very brief you know, introduction, like what are some of the things that I see more in my practice. And I'm like very open to like have questions and, you know, kind of answer as far as I know about things.
Show of hands, if you don't mind. How many of you have had a moment where you're like, I don't want to talk to anybody right now? Yeah. And I see some of you are patients, some of you are family members, the loved ones that are helping on this journey, the co-travelers on a trip none of you wanted to take. But this is hard. And when you're in a situation where maybe the family member or the friend who's trying to cheer you up and bolster you, and it's not working, or you don't want to share your darkest thoughts, what can you do? What do you do? You know, going to therapy is not a bad thing. It's a good thing because it does help. you get ready to keep doing what you have to do to do well, to thrive, to survive and go through the treatments. But there's so many aspects of bladder cancer that are really scary. And not every hospital has a palliative medicine team that you can be referred to. And I know that not every patient here is being seen at a large hospital, say like Mayo Clinic. There's some that are being seen in their community practices. So remember back in the beginning slides, I showed you that we do have the 833 Ask for BCA phone number for cancer care to speak to an oncology social worker that can help you find resources in your location. And what questions, Dr. Kapoor did a really nice and quick overview of some of the common issues. But I know sometimes the person with the diagnosis doesn't want to worry the person that's loving them and then helping them and stressing them out, but sometimes maybe they just want to be alone. What are your questions or concerns? And for the woman or the man who is helping, you just want to do everything you can and you want to be a cheerleader. But you know what? It's easy when you're burning the candle at both ends and the middle to run out of wax. It just happens, you know, how do you sustain? What kinds of things are burning concerns or questions for you? And then also you can share for everybody, how do you find a way to recharge your batteries, both whether you're a patient or a family member that's on this journey? So I'm going to open it up to questions because Dr. Kapoor hit on so many. You know, obviously, if you go back for scans regularly, how many of you get a little bit anxious? How many of you get a lot anxious? Okay, it's being honest here. We're all among friends. Everybody knows what you're going through. So if you have, you know, a story on how you benefited, you know, or what some of the concerns you have, raise your hand and Bernadette and Ivan will come around. We need to do it on the mic so everybody can hear, but go ahead, remember to say who you are and then ask your question. So we've got one in the back. Oh, we got a mic and any questions? Okay, no questions. You guys are all so chill. Because again, if you're so chill, tell us how you're doing it because somebody's going to benefit. So let's start here.
I was an EMT for 30 years. Talking about anatomy is no big deal for me. Been very open with all my friends and family, and everybody's comfortable with that. I use my overnight bag on a regular basis because I have kidney issues as well, and I'm drinking constantly, and I'd have to empty my pouch every 20, 30 minutes. A family member, different people have brought it up, but a family member just this week found me repulsive because of the bag, and we're dealing with that now. But I've talked to a counselor, and I said I don't have a trouble with people seeing my pouch. You want to see it? I'll show you my belly right now. I just don't have trouble with that. It's very frank. It's very open. I know that online there's a lot of products for people to keep it concealed because that's comforting for them. I just don't need to. But she really made me feel bad and ashamed about my feelings about it, and I'm dealing with that right now.
Thank you for sharing that. I think that's really important, and I think you know it's disfiguring in the sense that your body's not what it used to be. First of all, your bladder betrayed you, and then the treatments might have completely reconfigured you. And it's embarrassing. Nobody talks about urination. Nobody talks about sexual function. Nobody talks about any of these things that are impacted by bladder cancer. Dr. Kapoor, what can you suggest as an opportunity for growth and certainly to keep our individuals here feeling good? We don't want them to feel bad.
I'm sorry that happened, and I know that it's And thank you for sharing. I know it takes a lot of courage, and like Stephanie, you mentioned, we don't generally talk about a lot of these things, and I think it can be. I think the way I look at it is it's very hard when these things happen. You already have your plate full, right? You're like trying to get through it and really do what is best for you. So I think it's absolutely, you're right how you are doing it. So I think also taking a more, I think a lot of factors go into it. Like, is it a very close family member, or is it like someone who is just visiting? I think that can make a huge difference. I think a lot of times there is this time gap where the caregivers or even family members have to kind of understand like what's happening, and that might be a way of expressing distress. That doesn't make it any easier for you, right? But I think sometimes, in a way, if that can help you kind of get perspective and like what you do with that, I think I really like the way that you talked about it like openly, and it seems like you're working on it, right? And it's just kind of like getting them to. So I think a lot of times some education around like what the needs are, if things like that come up, like kind of putting your perspective forward by that this is really important. And if they're still kind of like not understanding, then I think do what is best for you. And the other thing, the other aspect is, how do you manage that distress? Like when someone says that, I can only imagine how hard and heartbreaking that can be, right? So it sucks, and it does. Yeah. And, and I wish we had like something. I talked to my parents, like it's we can do it, and it's very hard, but I think you have to make decisions that for your, like, what is the best for you and your immediate caregivers, and make a decision. If even after talking to them you still get that feeling, I don't think you deserve it. So you do the best that you can. You need to take care of yourself. And I think emotions, the more we are able to, it's not that you should not feel the emotions. I think it's really great that you feeling those emotions, you're able to talk about them. A lot of times we're not able to do that. And I always tell my patients, there's nothing bad about good emotions and bad emotions. Emotions are just emotions. So if it hurts, I think it's good to kind of realize why, and being, I think, coming to understanding that it's okay, we have to feel our negative emotions too. And I think it comes up with cancer a lot, with all the treatments and the diagnosis. And I think it takes a lot of courage to keep being positive. I think it takes more courage to actually be more accepting of your negative, like sadness and feeling hurt, and just, so do what's best for you, if that kind of like makes sense.
Ivan, or where's Ivan? Somebody get over there with a microphone.
Oh, did you have a question?
Oh, you want to, go ahead, follow up, yeah. And then we'll go over there next.
Sorry,
Gotcha.
it wasn't really a question. It's something you were asking about how you deal with things. And as a caregiver, when like, I kind of get pain when I'm really stressed out. So he'll ask me, "Do you want to take a bath?" So I'll run a bath with Epsom salt, and I sit in the bath for 2-3 hours, and I read, and that helps me feel better.
I think that's a great point. I mean, we do kind of like focus really becomes the person who has it, and I think that's fair. It's very reasonable. It's an obvious thing to do. But I think for caregivers also to kind of like have some mechanisms that are helpful for them for self-care. I think it is so important for the patient, for the individual who has the cancer, and for the individual who's caring for them. So I think both of their mental health is really important. So I'm really glad that you have something that you can, and that you can remind her that you need to do this. So I think you look out for each other. So I think that's the best way to do it.
How do you decide when patients need medication?
So that's a great question. I wouldn't say it's subjective in a way. It's kind of like the level of distress. So that's the first thing. If it's really impairing your functioning, if a patient tells me, I was working and now it's just, and they're able to say that, okay, I'm in remission, but it just feels so heavy. I just feel so sad that I'm not able to work. Then that means that they're not able to work, not socialize, not doing the things that they enjoy doing. So that kind of tells us that it's at a level where medication and psychotherapy might be helpful. The second part that I really, because I do a lot of medication management, So I do both psychotherapy and medication management because I'm both a psychologist and a psychiatrist. So it's a little bit different for me. I'm kind of very open. The second part that I was talking about is very much like what the patient is open to doing. So it has to be a very collaborative process. So if you tell me that you just do not want to do medicines at this point, I will tell you that if I feel that it's like there are suicidal thoughts or something like that, then I'm pretty honest with my patients and say that I really highly recommend that we do a medication. But at the end of the day, I think it really has to be collaborative. So it depends on the level of distress, the impaired functioning, and if the patient is willing to try a medication, I give my recommendations. That's independent. That's kind of like what I think would be the best, but I really do want to take into consideration. A lot of my patients tell me they want to try psychotherapy first, and I'm absolutely okay with that, unless until I really feel that if they're mostly it's like if there are things like suicidal ideation, a lot of hopelessness, because that's kind of tied in with if you're not emotionally doing well, I think it becomes more difficult, the recovery process. So if I feel that it's really interfering with treatment, so I think that is another indication that medication would be helpful. I hope that answers the question.
Thank you for coming today.
Absolutely.
I don't really have a question, maybe just an observation that I'd like to get your perspective on and see if anyone else in the room had a similar experience. When I was first diagnosed about 3 years ago, my response to it was, instead of feeling a lot of emotions and anxiety and grief, because there is a lot of loss with this kind of diagnosis, I just buried myself. I went on the internet and I read every medical journal there is. I wanted to learn everything imaginable about bladder cancer. And I felt that that would assure me of getting the best possible care. But now, with the benefit of time, in retrospect, I realized that I think all I was doing was kind of delaying and burying my own emotional response, and it came out later in terms of some very big anxiety, which I've gotten over now. But I just wonder if you find that there are people that do that. And what I've found was I had to just pull away from all that now. I realized I could never know as much as my surgeon about it, and I just put my faith in her and live my life and enjoy every day. So I don't know if anyone else had a similar experience. Yeah.
Any other comments? Obviously, this is not just about the individual with the actual bladder cancer diagnosis, but that peripheral partner on that journey. This is an opportunity to share what is working for you, because an Epsom salt soak in a nice warm tub for an hour with a book could be the perfect solution for somebody sitting over on that table over there. So if you have a thing that has worked for you, share it. This is a chance to do that. But, this idea about coming back for scans, are there things people could do in advance, because we know with clockwork when the next scan is going to be, and maybe it's a month ahead of time, maybe it's a week, maybe it's the day before, and maybe it just slowly builds to that point where you get to that day and it's like, oh my God, what are they going to find? Is there something you can suggest for self-soothing?
Absolutely.
Or just some way to keep calm and not let this take over?
And I know it is very difficult to stay calm. I'll tell you, I'm the most avoidant person. As a patient, I'm like the worst. I never dare do anything. And it's because I've over the years, I've realized that I'm very avoidant. So I don't want to look at any of my labs or anything like that. And I just don't know, I have this fear. So I think I see that in my patients, that there can be that really like, because I think if you think about, like, especially the scans, and if people have had recurrent cancer, if you think about it, there's a lot of trauma involved here, and it's kind of like bringing back those memories or flashbacks. And if the first scan was not what we wanted it to be, and then and every scan becomes like excruciating, right? Because you remember, you have those memories, right? Like there is a lot of medical traumatization as we go along in our cancer treatments. So I think the way that I generally do when I do come in contact with when my patients are referred to me by our social workers, I absolutely encourage them to seek therapy. And I think that is where you really start that journey, kind of like understanding what your reaction is, what is it focused on, what are you most scared of when the scan results will come back. So everyone has their different pain points and what triggers them. So I think knowing that, and also if like finding techniques, thinking about a little bit what's like bothering you the most and what is some of the ways that you use to self-soothe. So you gave a very good example, like ultimately you had to step away, right? So Dr. Google is killing all of us. Like I look at it, I can tell you I have a lot of health anxiety. I go on there and my dad is a physician, so I call him all the time. And then he was like, okay, you're a physician, you need to stop doing Dr. Google, like for every symptom. It's so hard not to do that, right? You want to get, not, you get, okay, is this bad?
At
So,
least go to bcan.org because that is vetted information.
yes,
Okay.
exactly. So having sources that are valid information, your surgeon like being the best person, discuss with your oncologist and your surgeons like what's like really on the top of your mind. I tell my patients when the scan results are about to come, to talk, like have a plan, talk to their doctors what they are looking for this time. How much should you worry? And sometimes they don't have answers. I think that's okay. At least they can give you some perspective. And then having self-soothing techniques like a bath with Epsom salt. Some people, I generally tell people, I don't have it right now. It's called a 3-minute breathing exercise. You basically just put your hands on your abdomen. You don't have to do anything. It's basically training your mind to be in the present moment, because we generally live either in the past or the future. So how do you, there are grounding techniques. So this is the best one that I tell my patients. You can just put your hand on your abdomen and go with the flow of your breaths in and out. You don't have to change anything. It might be fast, it might be slow, but it kind of like brings you in the present. And it's a marathon, it's not a sprint. So you have to train and train. You will wander. That is what human mind does. So it's finding techniques that are helpful to keep you grounded. Look for what you're looking, ask your doctor what to expect. I think just having some clarity is helpful.
Okay, we have a question here.
Yeah, my name is Mike. There's an app for that.
Oh yes,
Yeah,
absolutely. Is it Calm?
UCLA Mindful.
Oh, okay, I didn't know about that one.
Yeah, and to the other question about medication, part of my medical oncologist referred me to a psychiatrist after my diagnosis. The biggest problem I had was sleeping. I just, when I'd lay down, my mind would start racing and thinking about, the future and everything. Could not sleep at all, and she referred me to a psychiatrist, and they put me on mirtazapine, which has been very helpful. And then she introduced me to that Mindful app, and that it's a great app. And I don't use it a lot, but when I first was introduced to it and tried it, you just sit down 5 minutes, and it's great. But excellent app.
It's been helpful for you, seems like. That's a new one. So that's very helpful. So UCLA Mindful, and there are others like Calm, Mindspace. So but I guess the UCLA would be more medical, and that can be very helpful. So having those resources, looking for things that are working for you. And again, I think I should have put it on the slide actually, to think about it. Sleep is a big problem,
Yeah.
One of the first things you notice is insomnia, right? It's exactly what you're saying. You put your head on the pillow and everything is just like, it's like traffic jam, right, in your mind. Everything is colliding with, the thoughts are colliding with each other. And that makes it so hard to sleep. And it's like, I think all of us experience it at some points in our life for different things, but insomnia is a real issue, and mirtazapine is a really great medicine. I use it a lot in my practice. It's very good for sleep, it's very good for appetite, and it's such an excellent antidepressant. So I'm glad that you benefited from that.
I'm so glad you brought up the issue of sleep, because sometimes this diagnosis is the last thing you think about at the end of the day, and you can't let it go. And then if you happen to fall asleep, it's the first thing you think of when you wake up. And that's a sign of being under stress, right?
Absolutely.
So again, getting some help, I think, is really important and very impactful if it's the right help. So when you can use some of these tools, whether it's medicine or mindfulness or just going for a walk. I saw a wonderful slide at one point where it was a cartoon of a person taking a dog for a walk, and they had their little thought bubbles. And the dog's thought bubble was of the tree and the grass and the bunny. And then the human's mind bubble was everything at work was all over there. And I'm like, oh my God, that's me. I have 2 dogs. I take them for a walk. They're sniffing everything. I'm thinking, I got to get back. They're not done yet. We have to go. And it's really a moment of saying, let's be in the present moment. Let's stop, be grateful, and then go from there. So we had a question in the back.
Hi, my name is Colette,
Speak up a little.
and I wanted to address the first man that had a question. Sometimes I use humor, and I have a lot of grandkids too. So I have an ostomy bag, and her name is Annie. And so that's how we talk about her, we refer to her and make it a normal part of everything. So kind of that's what I did with the kids. You might try that with your family members. It kind of just makes it funny, bring humor into it. And for me, I lost all my focus for months going through all this. And when it started coming back is when I noticed I had lost it. And one of the things I tried to do every day was, I couldn't read a book. I would read a page and I would like put it down. I would start a movie and I wouldn't be able to finish watching it. So I tried with little things like solitaire on my phone, because I could just do the solitaire, complete it, go to do another game or whatever, but it was easy and senseless, and I accomplished something that made me feel better.
That's a great example. And yeah, if I get started on solitaire on my phone, I just go on and on. So I try to, it's like, it's also like, but I think that's a great example. And I love how you have described it, like with the grandkids when they're younger. So, finding ways, and it also depends, like if they are responsive, right? The family members, they really want to understand. But I think those are some ways that people find to kind of make it also, it's also in a way normalizing things, right? Like you're still there and you're enjoying, you can still, we just get caught up, and like we get so in our minds, it's very hard to step out. And another thing that, Stephanie, when you said that the walk, and of course like the dogs are very focused on the present and we are like all over the place, that's how our brains are wired. I think now there's so much evidence scientifically that nature is such a healer. So they are actually prescribing nature walks and things like that. Just being amongst like trees and nature can be very healing, and you don't have to like travel for that. We all have certain spots we can go to, walks, and I think that is all like part of like, but I love your, yeah, those things really help. They really help me, the video games and things like that.
Angie, go ahead.
Hi, I'm Angie Glender, and I'm going back to when the gentleman's on the mirtazapine. I'm not just a caregiver, I'm a cancer survivor as well. And then you end up being stressed and you don't know it. You end up getting that downward spiral. And I am taking medication. I don't think it's working. So my point is, if things don't work, then I need to look somewhere else and tell my doctor this isn't working. We need to try other things. And that came to my mind as we're talking, because I'm like, well, dang, I'm not sleeping. I have that stress and I'm taking something, but it's definitely not working. But it truly overcomes you. And like that one woman said just recently, you don't realize how far you've gone downhill until you start to come out and you're like, well, dang, I haven't seen people for a year, and you're not you. And so, but I do think a second opinion, or at least talk to my doctor and get on something else, so I can be like this guy, positive all the time.
True.
I think it is very important to talk to your, so when I start a medication, I try to follow them within like 3 to 4 weeks, giving enough time and knowing if it's working. And when my patients tell me, sometimes they say it's working, sometimes they say not. If it's working, what is it helping you with? what is still that you want more help with, and then kind of like if it's not working, like is it like flat out not working, but kind of like having options, alternatives. I always tell my patients, don't lose hope. If you don't respond to one antidepressant, we have others that we can switch to, and you're not like, if you started on one, you're not like condemned to be on that the whole time. We can absolutely make changes to bring it up. I think that's a great point.
That's the most important thing, because people don't always even bring it up that, you know, I don't think this is working. What can we do that's different? So make sure that you're giving good feedback as to what is happening if you're in any kind of treatment, if you're even taking medications or working in therapy. You know, keep going and keep giving so that you're getting what you need out of it. Okay, we have time for probably one more question, because I know you need to scoot in a minute.
My name is Kim. I'm from Colorado, here supporting my cousin who is going through this process, but also just want to say thank you to everybody who's here today. Also, that I think all of you are brave. I'm also a caretaker for my husband who has a different type of disease and process that he's going through, but I have also learned so much today. But two things that I have learned here today also is I think we all need to show each other grace, regardless of who we're caregiving for or who's going through it, because we both go through different circumstances. But at the same time, we're all going through the same thing and just need to recognize that, and that we're all in it together. As a caregiver and a family member of somebody who's going through something as well, I myself finally started to see and get help, because I am a big advocate of trying to find answers. And when I feel like I can't find those answers, then I started spinning. So if I'm not strong in myself and I'm okay myself, then I can't help somebody else either. So for me, I finally made that determination that in order for me to continue to be able to be supportive of my family, I had to be okay. And in order to do that, then I had to find a resource for myself. The one thing that she taught me is the back of our brain every 17 seconds has negativity. Every 17 seconds. Our frontal lobe is not fed on its own. We have to feed it. So every 17 seconds, when you have that negativity go into your frontal lobe, somehow, somewhere, whatever it is that makes that happiness for you in your frontal lobe, then you continue to practice that. And that has helped me so much. So for me, it's my grandkids. And that's one thing that she noticed. So every time I feel that fear or some negativity or something come forward, then I think about my grandkids, and then that all goes away. And it is amazing how that works, but it's all about practicing mindfulness. So I just wanted to share that.
Thank you. That is a great example. Yeah.
So I know Dr. Kapoor does have to leave because she has a little one that has to get picked up.
Yes,
Thank
I
you.
apologize for my,
Thank you
but I have to pick up
so
my daughter
much.
from
I know,
preschool.
and we don't want you to be late because we know what the daycare does. when
She's
that's
not
the
going to
case.
handle that well, so.
So this has been wonderful. I'm going to talk to you all. I'm going to let Dr. Kapoor leave so she can get to childcare on time because they don't like it when you're late. But I think one of the things is really impactful and helpful. You know, often family members outside of the immediate loved one that's on this journey with you say, hey, what can I do to help? Now, the reality is, thank you so much. If somebody asks you that question, what can I do to help? You have to stop for a minute and give them a task. You have to think about it. So the challenge is, how do you channel that in a way? People do want to help. Maybe you have a list of things that are going to be beneficial. Well, you know, I would love if somebody could come over and help me do my laundry. I just can't get to it. There's just so much going on. And there's probably a good friend or neighbor that would come and help do the laundry. Hey, you want to do something? Could you guys make a meal and freeze it so on treatment day we can have something when we get home and I don't have to cook? That's quick and simple. If you've got a quick list, then you don't even have to stop and think about it. But asking people, how can I help, is just putting more stress, because then the caregiver has to stop and think about what they can give you to do to make you feel useful. And yours is not the joy they're trying to maintain. It's their own joy and the joy of the person with disease. So don't make them do that. So come up with some quick things. So say, well, I could use some help grocery shopping, cutting the lawn, I can't do it anymore. All these things. Have a quick list, but then, throw it back on them. Say, well, what can you do? Because they often have some good ideas, but maybe they don't know how to ask. Say, can I bring you dinner? Can I do your laundry? I hope that this has been helpful. Obviously there is help out there, whether it's calling the 833 number, ask for BCA, or talking to your providers and getting a referral in your own local community. This is something that's really important. It's important for the individual going through disease. It's important for everybody who is coming along on this journey. We are gonna take a break, give you a chance to go back to your room if you want to, if you're staying here, or just sit down. You can step out by the pool if you want to. Take a moment. We'll be meeting back in the lobby here for happy hour and then a lovely dinner with all those great foods from Anne and Gretchen tonight on the other side of the hall at 6 o'clock. So you can also sit here and continue to fill out that sign-in sheet and get names of people you can connect with. So this is good. We're going to take a break. Thank you all.